This lecture addresses some topics in the respiratory system, namely carbon monoxide poisoning as well as cyanide poisoning. Patients with carbon monoxide poisoning may present with headache, and they might also have cherry red skin. Interestingly, both of these can happen with cyanide poisoning also. There is also an interesting MRI finding of bilateral globus pallidus lesions. This is classically associated with carbon monoxide poisoning. However, rarely it can also be seen with cyanide toxicity. Again, something both of these types of poisoning have in common, both of them inhibit complex 4 of the electron transport chain. So we'll briefly address the proton gradient, which they both decrease, and ATP synthesis, which they both block. Back to pre-med days and MCAT for a moment. The electron transport chain is how eukaryotes, including yourself, can ultimately get a lot more out of glucose than you would have gotten out of glycolysis alone. The point is to use at the inner mitochondrial membrane the electrons carried by FADH2 and NADH to create a proton gradient, and then use the proton gradient to power an ATPase. And the function of the ATPase is to create ATP. By the way, there are 2 vitamins which should come to mind if you can remember them. Their crazy names are 1, riboflavin, and 2, either niacin or nicotinic acid. The easier names are vitamins B2 and B3. Why should these 2 vitamins come to mind? They are relatives of the flavin nucleotides and the nicotinamides. So our electron carriers FADH2 and NADH are built from vitamins B2 and B3 respectively. It's complex 4 that carbon monoxide and cyanide inhibit. As part of oxidative phosphorylation, complexes 1, 3, and 4 are all proton pumps. So by inhibiting complex 4, carbon monoxide and cyanide decrease proton pumping. The idea is that by cumulative effect of complexes 1, 3, and 4, we would like to make the intermembrane space crowded with protons, so they want to get away from each other and escape back down through the ATPase turbine. And that is also called complex 5, by the way, the ATPase turbine. Decrease in proton pumping makes less of a proton gradient, less crowdedness in the intermembrane space gradient. So carbon monoxide and cyanide, by inhibiting complex 4's proton pumping, also manage to decrease the proton gradient. Okay, now zooming pretty far out for the moment to treatments. For carbon monoxide poisoning, we use 100% oxygen. In severe cases, we may turn up the pressure and use hyperbaric oxygen. For cyanide poisoning, there's a little more to know, and it has to do with 2 ideas used in different ways. The 2 ideas are 1, to get something to grab up the cyanide, and 2, to get the kidney to excrete some form of the cyanide. I think the most interesting one for grabbing up the cyanide is when we use nitrites to intentionally make methemoglobin, which can bind the cyanide, at which point we call it cyanomethemoglobin. There's also using hydroxycobalamin to bind the cyanide, at which point we call it cyanocobalamin, which can then be renally excreted. Or we can use sodium thiosulfate, which will convert the cyanide to thiocyanate, which also can be excreted by the kidney. For now, be familiar with hydroxycobalamin, nitrites, and sodium thiosulfate as treatments for cyanide toxicity. Now, I want to zoom out farther to tell a story or relate a historical anecdote. In February of 2021, Texas had a winter storm and an accompanying power crisis. I don't know how solid the numbers they have are, but there was sadly a death toll. And I know there also was ample concern that folks without power might turn on their car to help keep warm. Why is this not such a good idea? Well, quote, biggest epidemic of carbon monoxide poisoning in recent history, end quote, according to some experts. Texas does not require carbon monoxide alarms in homes, so people already suffering from the cold and lack of power would also have a hard time understanding what's happening as their kids lose consciousness. It sounds like a nightmare. Okay, now back to nuts and bolts. When you study Huntington disease, one thing you'll focus on will be that GABA, gamma aminobutyric acid, GABA is low in Huntington patients. You will also look at dopamine, specifically the nigrostriatal pathway, and note that in Huntington, dopamine is high. So when you study parts of the brain in the context of neurodegenerative disorders, you will learn about something called the lentiform nucleus. This lentiform nucleus consists of the putamen and the globus pallidus. And the globus pallidus has both an external and an internal portion. I'm mentioning these now just to make the uptake a little milder later on when you're focused on Huntington and other neurodegenerative disorders. But the globus pallidus, as we said earlier, can show lesions on MRI in the case of carbon monoxide poisoning. Also, rarely, lesions in the same region can be seen in patients with cyanide poisoning. Okay, let's tie it all up. Both carbon monoxide poisoning and cyanide poisoning can happen to patients who have escaped from a home that caught on fire. Because the airway can swell up from the various irritants and particulate matter inhaled, it may be important to intubate such patients before the airway swells shut, and then it would be impossible to intubate to get the airway open. Carbon monoxide poisoning can happen in a few ways. One is from car exhaust fumes. Another way is smoke inhalation injury for fire victims, meaning like arson. Cyanide poisoning can happen in several ways. One maybe more common way is smoke inhalation injury for fire victims. There's also like apricot seeds and straight cyanide ingestion in a suicide act. Carbon monoxide and cyanide each are capable of inhibiting complex 4 of the electron transport chain. Therefore, both decrease proton pumping, thus decreasing the proton gradient. Decreasing the proton gradient in turn blocks ATP synthesis because the ATPase requires the flow of protons down their gradient. Patients with carbon monoxide poisoning may present with headache, and they might also have cherry red skin. Both of these can happen with cyanide poisoning also. MRI brain of a patient with carbon monoxide poisoning can show bilateral globus pallidus lesions. Such a finding is classically associated with carbon monoxide poisoning, but it is also possible with cyanide toxicity. Treat carbon monoxide poisoning with 100% oxygen. In severe cases, we may use hyperbaric oxygen. For treatment of cyanide poisoning, the themes are 1. Chemically grab the cyanide, and 2. Excrete renally. Treatments include hydroxycobalamin, nitrites, or sodium thiosulfate. Okay, that's it for this one.